people. This is the second time I have tried filming this video.
Tic management strategies are necessary for people who are distressed by their tics or harmed by them. Medication for Tourette saved me as a child when I was extremely disabled by tourettic OCD and tics. The point of this video isn't to say not to use a management strategy, but to say that it has to be used for the right reasons. For example, it should be used to help the person with Tourette's to have a better quality of life, not to try and normalise them for the sake of it. And it should also be the individual's choice. Medical interventions are necessary for my tic management, but I've gone down the more natural/alternative route as that works best for me. So my tics don't bother me as much now as they used to, so I don't feel the need to go back on antipsychotics or anything unless I was to develop some kind of psychotic disorder. Another thing as well is that in this video I talk about, therapists who gaslight their patients. I think it's important to say that not all are like this. There are actually some really nice therapists. I'm actually friends with some therapists who specialise in Tourette's. So obviously this isn't about all of them. This is just about some who need to do better to listen to their patients and not gaslight us.
One of the first things I wanted to talk about was the new Pulse device, the thing that looks like a wristwatch and that sends electrical signals to stimulate nerves and reduce tics. This is a brilliant invention that can potentially really help people who have painful tics. It can reduce the tics that cause injury. It can possibly reduce the severity of tic attacks. It could potentially give people a break from ticking if they're giving a presentation where they don't want to tick or something. I think it's a brilliant thing, and it's something that I would have really wanted when I was 14 specifically, because I wish for something like that. So I think it's absolutely brilliant that it has now been invented. I think it's really important to point out, though, that people with Tourette syndrome need to be the ones to use certain interventions. A person should never be forced or pressured or coerced into using a certain intervention. And the reason I say this is because when I was in school, my teachers would try and do anything to stop me from ticking. For example, I remember one of the members of staff emailing my dad and saying that I needed to go on more medication. And we had to explain that it isn't quite as simple as that. You know, you can't completely get rid of my tics. And I remember sitting in an exam room and they didn't want to follow my accommodations. They put me in a room with two other people despite the fact that I was supposed to be in a room on my own because of my tics, but they just thought that instead of following her accommodations, why don't we save space and money by only having one invigilator to 3 people rather than 1-to-1, and have her try and suppress instead throughout the exam. And it was horrible because I was constantly pressured to just stop ticking, and I was told to hum because they thought that would stop my tics, but it isn't as simple as that. So I ended up crying my eyes out because they wanted to try and stop my tics just so that they didn't have to follow my accommodations. And I do worry, with the new Pulse thing, what if students are kind of forced to wear it in exams and things just because schools don't want to give them the accommodations that they need? People need to understand that this wristwatch thing, it isn't a cure. I researched it and it said that about 60% of people experienced a 25% reduction in tics with active stimulation, and that is brilliant, but again, that is definitely not a cure. So I do worry if it's going to be a situation like I was in where the kids are pressured to wear it, and then when it doesn't fully work, they're kind of blamed for it and made out to just be an attention seeker or faking or something or exaggerating when that's not what it is at all. And that's why I become a bit concerned when I see it marketed as a cure. I have seen some news networks call it a cure for Tourette's, but it isn't that simple, unfortunately. And that's why I fear that kids could be kind of forced to use it just because schools don't want to give the accommodations, they want to save money, but it's not that simple. And I know some people in the trial who actually said it's quite painful to wear. The stimulations were quite painful. Some people didn't find that, but some people did. So I do worry about, kids kind of being pressured or forced to use it just because the schools want to save money or normalise them or make them be quiet for convenience or something. That kind of scares me because that's the sort of situation I was in at school. They would constantly try to get me to do things thinking it would stop my tics. And I felt like a complete inconvenience due to that. And I feel that no kid with Tourette's should have to feel that way. So I do worry about the ethical considerations interventions should be used for the person with Tourette's to help them, not just to normalise them or fit them into a neurotypical box for the sake of it. It has to be used for the individual, not for the school, not for convenience, not to save money, not to stop bothering the teachers, you know. It's really important to have these considerations and make sure it is used ethically. And another thing I wanted to talk about was the therapy for Tourette's. Cognitive behavioural intervention for tics is a brilliant therapy for some people. I personally use tic redirection for certain tics. For example, I had a really nasty one where I would kind of stick my fingers down my throat and it was trying to make me gag, and that was really horrible. But thankfully I was able to teach myself to redirect it, and I kind of just tensed the muscles here and it worked, and I didn't have to do it so much anymore. So redirection can be brilliant, and I know some people who this therapy has really helped them. And for example, my friend, the tics were so severe that they couldn't be in school, and the therapy allowed them to go back to school, which was brilliant. But like any Tourette's intervention, it isn't 100%, and it isn't a one-size-fits-all. Because I also have heard from people who said that it made them worse. So that's something that needs to be taken into consideration as well. There is no one-size-fits-all, and this is why people need to be able to make their own decision about the sort of interventions that they use, because I believe that an individual knows themselves best. I was referred when I was 15 to this kind of therapy, but I ended up not going to it because I realised that it wouldn't be right for me. And the reason for that is because CBIT and redirection can be great if you have a repetitive tic, but the problem was that most of my tics at that time were sort of one-off tics, so I would just comment on my surroundings, and you can't really redirect a tic if you don't know what the tic's going to be. I mean, you kind of can, there are tic blockers, but again, it's not that simple. It is much more complex when you have a one-off tic. If you have a repetitive tic and you know what to expect, it's much easier to redirect. But as well as that, I have never been keen on the ERP element. That is something I'm actually very against, unless it is only used temporarily to prevent harm. Or get someone out of a harmful situation. I do not believe that ERP should be a long-term solution, because it is akin to tic suppression, and for me personally, tic suppression has just always made me worse. And I've done a poll as well, and almost everyone with Tourette's that I've spoken to have said that tic suppression does cause problems. The Tourette CBIT Foundation on their Facebook posted that tic suppression can make it impossible to focus, and that is true. When you are focused so much on just holding your tics in, you literally can't do anything else. And for me personally, I have experienced rebound effects. My entire life, I've had rebound effects from suppressing. It gets worse later on. And some people do kind of try and gaslight me, and they don't believe me. They say, oh, the study said it doesn't happen. But even though the studies say that, I'm not lying about my experience. And I know countless other people with Tourette's as well who have said that tic suppression makes them worse. So I think that the reason that these studies come up with these results that don't actually, you know, a lot of the Tourette's community don't understand how it keeps coming back with those results. I think it's because when we have those rebounds after suppressing, it's often in the evening when no one is watching. We let the tics out when we feel safe, when no one is around us, and therefore people wouldn't really see the rebound, and therefore the studies will say that it doesn't happen, even though it does, but, you know, they haven't seen us in the evenings when we hide away and let our tics out. And another thing is, a lot of these studies have ERP therapists involved in them, and I believe that is a bias, that is a conflict of interest, and that needs to be taken into consideration because these results can be easily manipulated, I'm not going to lie. And as well as this, we need to be aware that people with more severe and complex tics are often turned away from these kind of studies. I know people with severe tics who tried to partake in a behavioural intervention study and they were turned away because their tics were too severe. So I don't believe it is right for these results to be generalised to people with severe tics, like if they weren't included in the study, because severe tics are more complex. They are different from the more subtle tics, and they can be harder to suppress. Therefore, I don't think the results should be generalised to those of us with more severe tics. But it is frustrating when people try to disbelieve you, when you say, oh no, this makes me worse, and they say, oh, well, the studies say it doesn't. And I'm like, you know, I'm not lying about my experience. The studies are generalised, but they shouldn't be, because everyone is an individual. So I don't think studies should be used to gaslight people or disbelieve people when they speak about their experience. And that's the problem. Like, I really struggle with some of these therapists. Like, I've met some amazing CBIT therapists who I'm actually friends with, but at the same time, there are some that aren't fully professional because they don't listen to those of us who actually have the condition. And I'll give you an example. A few years ago, there was a book that came out, and the book itself isn't important. That's not what I want to talk about. But basically the book contained a couple of pages on tic suppression, making out that it's a solution, when, as I said, that's kind of problematic, because for a lot of us, we find that tic suppression makes it impossible to focus. It can make things worse later on. For me personally, it triggered rages, because the urge to tic would accumulate and eventually explode out as an involuntary rage attack, and it can make people feel very, very tense and therefore anxious as well. So tic suppression should not be seen as a solution, especially not a long-term one. And basically someone with Tourette said this in the review. They were just being honest and said that they were quite concerned by it, because I would be too. But unfortunately, they said that allegedly the author contacted them and asked them to delete their review. And then after that, I noticed that a lot of psychologists came on and left their own review and called the individual with Tourette syndrome myth-peddling, just for voicing their concerns and speaking about their experiences. But surely, if they really wanted to help people with Tourette's, they'd listen to us instead of just calling us myth-peddling for raising our concerns and talking about our experiences. And they also said that tic suppression isn't painful, which I thought was ironic, because the people who wrote that, the psychologists who wrote that, they have probably never experienced tics in their life, so they can't imagine what it feels like. Whereas when those of us with Tourette's actually say, you know, it is painful, like for me personally, it feels like I can't breathe. When we say how distressing tic suppression is, they don't believe us. They call us myth-peddling. They say that we're lying, and we're not. We're just being honest. But surely if they really wanted to help us, they would listen to us and, you know, have empathy when we say that this hurts us. Why do they seem to like to gaslight us and disbelieve us? Why do they not listen? It just doesn't make sense to me. If they're there to help us, why do they not listen? I know a couple of people with Tourette syndrome as well who have been to sort of conferences, and they've asked CBIT therapists certain questions about the safety and efficacy, and apparently they're always very defensive, which is very strange as well. Like, if you want to help us, why can you not just have an open conversation with us? Why can you not listen to our concerns and reassure us that if CBIT doesn't work, there are other options? Why are they defensive? That's what I don't get. And I just don't get it. Also, the psychoeducation aspect is a bit ironic, because it's scary. I know a lot of people who've been told in the psychoeducation that tic suppression isn't harmful, it doesn't hurt, there is no rebound, but that goes against the experiences of countless people with Tourette's that I know. That's why I decided not to go forward with the therapy myself, because I did not want educating on my condition from someone who has never experienced it and could never understand what it feels like. I got my psychoeducation from people who actually have the condition, and that helped because it reassured me that no, you don't have to suppress. Suppression is harmful. It can cause more problems. You've got to tic freely. And honestly, unlearning automatic tic suppression was one of the best things I ever did, because some specialists unfortunately think that we need to learn to suppress. I remember a few years ago, someone wrote in a leaflet, they're a big Tourette's expert, but basically they were involved in creating a leaflet that said that students with Tourette's should have help to increase voluntary tic suppression or something along those lines. And it was quite concerning, and a lot of people with Tourette's did voice how this is dangerous, but again, I don't think people really listened to. I knew how to suppress tics from the get-go when I first developed them, and that was so harmful, because then I would suppress them in school, I would hold them in, I would mask, and that meant that I was constantly experiencing discomfort, and that my symptoms would explode when I got home, especially in rage attacks, because the urge just accumulates and explodes. So to say that tic suppression is a solution is really harmful and dangerous. They would rather we're unable to focus in school and get poor grades due to that than just let us tic freely and be ourselves. And that is so concerning, because I made the conscious decision when moving to secondary school that I wasn't going to suppress anymore. And I'm so glad that I made that decision, because yes, I did get teased, but at least I was myself. At least I wasn't in discomfort anymore. At least I wasn't suffering the negative effects of tic suppression. So it really scares me when they talk about like teaching tic suppression, because for a lot of us it's actually something that we do automatically and we are having to unlearn it. I know I spoke to an adult who had CBIT and they said that it taught them automatic tic suppression, but the problem is that now they can't unlearn it despite the fact that it's harming them. And a lot of adults with Tourette's say that they wish they could unlearn automatic tic suppression, but they're at this point where they can't. And I personally believe that automatic tic suppression is a bit of a trauma response, because we only feel the need to suppress our tics, automatically without even realising we're doing it, or without choosing to do it, if we're afraid, or if we've been made to feel like a rebel for ticking or something. So to have therapists who call themselves experts saying they want to teach people to suppress, it is terrifying. I'm being completely honest, because the best thing for me would have been a therapy that actually taught me not to suppress. And it is good that I have one friend who said that the CBIT therapist is helping them unlearn automatic tic suppression, because that is exactly how it should be. If something is harming us, like suppression, we should not be encouraged to do it. And we should be believed when we say it that it harms us and makes things worse later on. But the problem is that we're often not believed. And that's really concerning, because I'm so glad that I grew up at a time where people knew that suppression was harmful. When I was growing up, the message always was, tic suppression is harmful, don't do it, which was the right message. But sadly now, over time, it's changing. And I know people in the UK have actually said that they're referred to suppression therapy. And that scares me, because, again, suppression was one of the most dangerous things I did, and I'm learning it was the best thing. So I believe that therapy should actually be there to teach people how not to suppress, how to tic freely, so that they don't suffer with the horrible urges, because the urge to tic was worse than the tics themselves. When I would scratch myself as a tic, that didn't hurt nearly as much as suppressing and not ticking. So, you know, I really feel for young people with Tourette's now and their families, because they're going to believe that the therapists and doctors know best, but in my experience, they don't. I'm very well aware that they studied a lot. You know, they went to university and medical school, but people with Tourette's aren't really involved in those teachings, especially not medical school teachings. So I feel like we're never really listened to or understood. They see us as an inconvenience when we question these things or say that they don't work, because they were taught that they do work. So they're very by the book, they're very rigid, and they don't listen to people who actually have the condition, which is, you cannot expect to have a therapy that works well without talking to people who actually have the condition. There was a teenager with Tourette's who told me that the therapist made them feel like a rebel for ticking, and that's really disgusting, because instead of that, we should be empowered to tic freely. It is not right to make somebody feel like a rebel for something that they cannot control. So I've had a huge problem with these therapists who claim that they specialise in Tourette's, because some of them are great, but others seem to just encourage suppression and make people feel guilty and shameful for ticking, which is one of the worst things you could possibly do for a person with Tourette's. I actually have a lot of fear for the future, simply because of the doctors and therapists in power in the Tourette's community. It makes me fear as a Tourette's individual for the future. I mean, what does that say if those who claim to help us are actually filling us with fear and concern? I just hope that the voice of people who actually have Tourette's is listened to more, and one day we can see that suppression is not the answer. People don't understand us. It's kind of like ABA with autism. A lot of people in the autism community say it's harmful, and I know some people find it helpful, which is great, but for a lot of people it's used in the wrong way, and it makes autistic people feel like a rebel for stimming, and it just tries to normalize autistic people and make them act neurotypical without getting to the root of like why those things are occurring. For example, it might force autistic people to make eye contact, despite the fact that there's a reason they're not making eye contact. It's because it makes them uncomfortable, so it's actually helping them not to make eye contact. Like, I unlearnt eye contact, and it was brilliant because I was unmasking and it helped me. So it kind of reminds me of that, like, this ERP element where people are taught to suppress. It's kind of like that. Because it's just causing more problems, but they're internalized problems. We might seem fine on the outside, but in the inside we're not. And in terms of medication for Tourette syndrome, again, this has to be done with the right intention. It needs to be done with the intention of helping the individual with Tourette's and not simply to try and normalize them. We should not be put into a neurotypical box for the sake of it. And especially with these medications, they are quite strong, and they can have side effects. So it needs to be done for the right reasons. As I said, I went on risperidone as a child. It's a strong medication, but it did help, and my parents did put me on it with the right intention. It was to help me, so I'm grateful for it. But I eventually went off of it because it's strong. As I said, it does cause side effects, and I didn't really need it anymore. And now that I'm an adult, I wouldn't go back on it, simply because I have learned to love my tics, and it is not a sin to want to be myself. People have told me that I'm selfish for not treating my tics, but I don't see how existing as a disabled person is selfish, because I'm just being myself. And people need to learn to embrace that. They need to learn to embrace difference. You know, people with Tourette's shouldn't have to drug themselves up with loads and loads of strong drugs that can cause side effects like Parkinson's. I can't even say it, but it can cause Parkinson's-like symptoms. It can cause, again, I don't know how to say it, tardive it can cause involuntary movements. I can't pronounce the side effects, but I know what they are. It can cause an increase in prolactin, which can cause breast milk coming out. It's unpleasant. So there are a lot of side effects from these sorts of medications, and that's why we should not be just drugged up for the sake of it. It needs to be done to help people, because if we're constantly drugged up with these things just to seem more normal, it's going to cause more problems. It also isn't right to expect these things to fully get rid of tics, because the reality is there isn't a cure, and these things can help, but for a lot of people they don't fully get rid of the tics. Like, for me, they did for about a year or two, and then they came back severely. So, you need to remember that it isn't a cure. So just constantly dragging us up to try and stop the tics for the sake of it, that can just cause more problems, like the severe side effects. So learning to accept your tics is so important, and learning how to advocate for yourself and tic freely, and just be happy as you are as a tourettic individual, that is so important. Also, I think I forgot to say this, but in regards to the new pulse, the wristwatch thing that sends the signals down the nerves, I personally wouldn't use it. Not that I have a problem with it. Again, I think it's a brilliant invention, but I have more than one neurological condition. So as well as Tourette syndrome, I have postural orthostatic tachycardia syndrome, and I also have a condition that causes muscle weakness. And my concern basically is, it might help with my tics, but what if it worsens the other health issues? Because it hasn't really been studied on people with these other health issues before, so I don't know if it could make it worse or not. So that's kind of concerning, because I know some people with similar health issues to me who have used nerve stimulation technologies, and it's made them permanently worse. And it probably won't happen with, this one, because it isn't quite the same. It isn't the same nerve that it's stimulating, but still, if it hasn't been studied on people with these other conditions, I do worry how it could affect them. Because I have more than one neurological condition, it's a bit more complex. Basically, what this comes down to is the interventions used for Tourette's need to be done with the right intention. It needs to be the person's choice. We shouldn't be normalised for the sake of it, because that can cause problems, especially with self-esteem. And the therapists specialising in Tourette's need to start listening to us. You cannot truly be a specialist if you don't listen to the people who actually have the condition. And I've just never seen something as ironic as people who have never experienced tics thinking that they get to disbelieve people who actually have tics just because they have a degree. It doesn't work like that. Having a degree doesn't mean that you know what it feels like, so you have to listen to us. And, I have so much discomfort around a lot of Tourette specialists. They genuinely fill me with fear. That's not how it should be. These specialists should be people that people with Tourette's feel comfortable speaking to and asking questions to. But I know that if I speak to them, they're just going to gaslight me and tell me that, tic suppression isn't harmful, so I know I won't be listened to, so I don't feel comfortable with them. And I do really feel for young people now and their parents, because they will be referred to these so-called specialists thinking that they know best, but they might learn the hard way that suppression isn't really a solution in the long term, and they might learn the hard way that these doctors don't always know what they're really talking about. I know a lot of these, not all of them, but I know a lot of these so-called specialists who don't believe in pandas and pans, and considering that Tourette's can co-occur with pandas and pans, and the fact that a lot of people with pandas and pans are misdiagnosed with Tourette's, it's harmful that they don't believe in it, and it's quite concerning. They don't seem to get to the root. Like, they'll give you therapy to manage the tics, which is great for some people, but for some, they said it made them worse. So they should be looking to the root more. They should be looking like if there's an infection that could have triggered the tics up, if there's underlying inflammation, but they don't often check for these things. Sometimes if they're open-minded, they'll do a throat swab for strep, but they won't look much deeper, because for some of us with PANS, I have PANS as well as Tourette's, and that can also cause tics, and it worsens my Tourette's tics. For some of us, there's other infections like Lyme disease for me that worsen the tics. So I feel like we need to have more of a root cause approach rather than simply managing the tics as they come as well. Because once the root is addressed, we kind of have the answers we need. And it's kind of made me see that all of my health issues are linked, because Lyme disease triggered PANS for me, and that the PANS worsened my tics and caused severe OCD. But Lyme can also cause POTS, so it did for me as well. So it's kind of like all my health issues end up linking, but if you don't have a root cause approach, you're never going to find the link between them. So I think that's something that's important to consider as well. The thing is, I don't hate my tics. So despite the fact that some people think I'm selfish for not getting rid of them for some reason, even though it isn't a sin to be disabled, I don't hate my tics. They are part of who I am, and honestly, my tics are a great tool for weeding out the sort of people I wouldn't want to be around, because the people who kind of snarl at me or move away from me when ticking or judge me or look down on me, they're the sort of people I wouldn't want to be around anyway. So I like that my tics can kind of weed those people out. And also, my tics, I don't want to conform to society, if I'm being completely honest. I am someone who embraces being different. So I'm not going to try and stop my tics just to fit in, because I feel that we're not going to be able to make much of a difference to the world if we're all fitting in. We have to be unique in order to make a difference. And for me, when I'm ticking a lot, it actually usually means that I'm feeling well. I know the common consensus is that tics get worse with stress and anxiety, but for me, they actually get more intense when I'm happy and excited. So, when I'm ticking a lot, it's actually a good sign, because I don't tick a lot when I'm feeling unwell. Like when I have a migraine or when my muscles are really weak, I don't tend to tick very much. But when I'm feeling happy and healthy, I actually tick a lot. So for me personally, my tics are actually a good sign, because if I start ticking loads, it kind of means that I'm happy and excited and feeling well and vibrant within myself. And interestingly, when I tick, I feel a lot more creative. I can think quicker. I don't have as much brain fog. I feel like myself. Like when I tick, I feel like myself. It's the only time where I can think truly quickly, and I have that creative spark and that desire to make a difference. I have so much motivation when I tick. And I believe that's just because the higher levels of dopamine associated with having tics. When my dopamine is higher, I will tick more, but dopamine that's high can also give you more creativity and motivation. But honestly, I love it. I wouldn't want to get rid of it. When I tick, I feel more like myself. So it's not something I would want to get rid of. But thank you so much for watching. I hope this was helpful. Please leave your comments down below. Different things work for different people. Tell me how things worked for you. For some people, they've said that CBIT's really helped them. For others, they've said it's made them worse. Some people find medication really helpful, but others have had side effects from it.